Hello everyone, welcome back to my YouTube channel, The Exploring Medico. So today we are going to discuss the last part of the upper limb osteology, that is carpal bones, metacarpal bones and phalanges. That is the entire hand, or where each and every aspect will be covered. In case of doubt, you can ask in the comment section. Also, if you want any kind of changes, you can request in the comment section. We'll try our best to make it so. And watch the entire series of the osteology so that one by one all the bones will be cleared. Upper limb bones will end here. Okay, so let's start without wasting time. So this is the hand, dorsum of our hand, which you are seeing. And first we will discuss the carpal bones, which are 8 in numbers, which are present here in our hands. So if we talk about the carpal bones, first we will talk about the proximal row, then we will talk about the distal row. This row is known as proximal, this row is known as distal. So if we talk about the proximal row, then this bone is known as scaphoid. This is known as scaphoid. This is known as lunate. This is known as triquetral. And above triquetral you can see this dot-like bone is there, small one, which is known as pisiform. Now if we talk about the distal row, then trapezium, then this trapezoid, capitate, hamate. Total 8 bone. 1, 2, 3, 4th is above 3, that is pisiform, then 4, 5, 4, then 5, 6, 7, 8. Total 8 bones are there. And to remember this, a mnemonic is there. She looks too pretty, try to catch her. That is scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, hamate. So these were the 8 bones, carpal bones. Now if we talk about the individual identification of carpal bones, then you can easily say that scaphoid is a boat shaped like this, and it has tubercle on palmar surface, that is here, which you are seeing this space, this is known as tubercle. Then if we talk about the lunate, it is moon shaped. If we talk about the triquetorial, it is pyramidal shape like this, you can see, that's the pyramid. If we talk about the pisiform, it is P shaped, which is a small bone. If we talk about the trapezium, it is quadrilateral in shape, and it also has groove on the palmar surface, you can see. If we talk about trapezoid, then it is shoe shape, this one. And this is capitate, which is the largest carpal bone. Do remember, okay? This is capitate, which is the largest carpal bone. And if we talk about the hamate, it is a wedge shape, that is like this. Now if we talk about the ossifications of carpal bones, then capitate is the first one to ossify at the month of second. That is second month, the capitate, which is the largest bone, that ossifies at second month. Then if we talk about the hamate, then this one, then it is end of third month. Then triquetorial, that is this, it is at the third year. Then lunate, scaphoid, trapezium and trapezoid. In females, ossification occurs at 4th year, while in males it occurs at 5th year. And if we talk about the pisiform, which is P-like shape, it is the last bone to ossify when the male is of 12 years and when the female is of 9 to 10 years. So this was about carpal bones. Now if we talk about the clinical anatomy of the carpal bones, then the bone is, which is known as scaphoid. Generally in the carpal, the common site of fracture is scaphoid fracture, and this fracture occurred when the hand is outstretched. And here the clinical, if we talk it, the blood vessel passes in the palmar as well as dorsal aspect, but generally most of the vessels passes in the proximal aspect through distal point. So in this condition, when the scaphoid is fractured and the nerve is passing to the distal point, at that time it is deprived of blood supply, that is blood supply is not adequate, and at that time it can undergo avascular necrosis. Do remember this. Now we will talk about metacarpals, which are 5 in number. This is 1, this is 2, this is 3, this is 4, this is 5. 5 metacarpals. 1, 2, 3, 4, 5. And metacarpals, if we talk, it has 3 parts: head, shaft, base. This is head, this is shaft, this head, this shaft, this base. Okay, base is generally proximal and expanded, which joins with the bones, carpal bones. If we talk about the shaft, it is concave on palmar aspect. You can see all the bones are concave. You can easily observe like this. It is cave shaped, concave. And if we talk about the head, it is distal and round. Why it is? You can see distal and all are round. See where it is forming joints. So these were the peculiarities of the parts. Now if we talk about first metacarpal, some of the points or peculiarities, and first metacarpal is this one, which is on the thumb and which is shortest and stoutest. And generally, if we talk, it has rotated medially through 90 degrees, so the dorsal surface faces laterally. So this is which is rotated 90 degree like this, so that it faces laterally and dorsally, that is downside. Okay, like this one. Now if we talk, the head is convex and broader other than metacarpals. Compared to other metacarpals, this head is broad, that is big head of first metacarpal than all this. Then it has epiphysis at proximal end and metacarpals which have epiphysis at the distal end. All the metacarpals have epiphysis at the distal end, but it is only the one that is epiphysis at proximal end, that is first metacarpal. Now if we talk about the ossification of these 5 metacarpals, then primary center occurs in the shaft here in the 9th week of intrauterine life. Then secondary center occurs in the head of the 2nd, 3rd, 4th and 5th metacarpal. 2nd, 3rd, 4th and 5th metacarpal at the age of 2 years, and it fuses at the age of 16 years. And secondary center for base, that is here in the first metacarpal, occurs at the age of 2 years and ossifies at the age of 19 years. Now if we talk about the clinical anatomy of these metacarpals, then there are 2 types of fracture. One is Bennett's fracture, B-E-N-N-E-T-S. Bennett's fracture is it is an oblique fracture where first metacarpal dislocate due to subluxation or dislocation, that is Bennett's fracture. And one is Boxall's fracture, which is the fracture of a neck of metacarpal, that is here, and most commonly neck of 5th metacarpal, that is this one. Getting it? And now if we talk about the phalanges, which is 14 in number, we can count in our hand 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 13, 14, 15. Same way we can count here 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. In first metacarpal, after metacarpal, only 2 phalanges are there. So it is 14 in number. And then each phalanx has head, base and shaft. If we talk about the base, that is here, then proximally have a concave oval facet for articulation with the heads of metacarpal. You can see it is concave to articulate with the head of metacarpals. And the base of the middle and distal phalanges, that is middle and distal phalanges, that is this both, upper one, possesses a pulley shaped articular surface. These all are pulley shaped, you can see straight, they are not concave like this. And if we talk about the shaft, then it tapers towards the head, that is upper side. From the dorsal surface it is convex, you can see from dorsal it is like this, convex. And if we talk about the head, then proximal and middle, that is this and this both. Proximal and middle phalanges are pulley shaped, and head of distal phalanges is non-articular and has a rough shoe shape. These all are shoe shaped and rough. If we talk about the ossifications of these phalanges, then primary centers of proximal phalanges occurs at the 10th week of intrauterine life, middle phalanges occurs at the 12th week of intrauterine life, and distal phalanges occurs at 8th week of intrauterine life. And if we talk about the secondary centers of ossification, then it appears at 2 years and fuses at 16 years. And any phalanges is fractured, then generally it is to be wrapped with the neighboring finger. That is, if this finger is fractured, then these both fingers are wrapped like this. Then it can be easily healed, it can be easily treated. And pisiform is a type of sesamoid bone because it has the tendon attachment of flexor carpi ulnaris. Do remember this peculiarity of pisiform bone also, because it gives origin to the tendon of flexor carpi ulnaris. So this was all about the carpal bones, metacarpal bones and phalanges. So here the upper limb osteology ends. If you have any doubt, make sure you ask in the comment section. Watch the entire series of all the subjects, whichever you are there, whichever it is possible, whichever you find harder. We are trying to provide the best content. So do like the video, subscribe the channel, share the video with your friends of medical, paramedical, nursing students. Okay, thank you. Have a good day.